So hello, good day to everybody. Today I'll be sharing community-centric approach to Project Wolbachia, Singapore. As what Dr. Tan mentioned, I'm leading the team that is in charge of communications and community engagement to ensure successful outcomes for Project Wolbachia, Singapore. Right. So the outline of my presentation today will start off with a brief introduction to share a bit of context in terms of the setting that we are implementing Project Wolbachia. We'll also be sharing our community engagement framework to help us, to guide us in achieving our objectives. I will also be sharing our evaluation and lastly, some checklist to get you started in planning your own communications and engagement plan in your setting. I also would like to encourage everybody to review and consider whether the concepts and the strategies that I'll be sharing can be applied to your local setting, right? Because the sharing that I will be doing is really unique to Singapore. Right, and I would like to begin with, sharing a bit about Singapore and the unique background that we are in, and the considerations that we have for the implementation of Project Wolbachia here. We are a small country in Southeast Asia, very dense population in a very small area. 90% of people live in high-rise apartment blocks, so highly urbanized kind of setting. We are a multiracial society comprising mostly of Chinese. Then we have Malays, Indians, and other nationalities as well. So Singapore is a fairly young nation, 55 years old. And over the last 5 decades, we've seen rapid development and economic boost. There were improvements in sanitation and housing. People are more affluent, and what Dr. Chong mentioned earlier, people are more sensitive to the presence of mosquitoes and pests in general, right? So they're very sensitive to that. And all year round, we have our national dengue campaign to promote community action, focusing on source reduction. And this aligns very well to our Wolbachia technology suppression approach. And we have a lot of access of information right now. A lot of public health messages actually competing for attention, right? And on the flip side, there's also the misinformation. So this is the backdrop of where we are for Project Wolbachia in Singapore. And with that, we established our communication and engagement objectives. We want to increase awareness and educate the public on the need to test novel tools for dengue control. We want to garner support and build trust for the project. We also want to promote community ownership through advocacy and volunteerism. So in order to achieve our communications and engagement objectives, we have a community engagement framework that guides us. And our approach is systematic, comprehensive, by combining both science and customized communications to address public sentiments, political views, and being mindful of cultural sensitivities. So the 4 components under this framework is education, consultation, involvement, and feedback. Right, and I will be elaborating more with some examples in my subsequent slides. So since 2016, we have really come a long way in terms of reaching out to residents. We managed to do that and reach out to more than 300,000 through various communication channels. So in terms of public education, I think you will all agree with me that the most important tool in your power is your ability to communicate and influence, right? And we need to convey our messages clearly and make it impactful. So how do we do that? I would like to always start with, setting clear communications objectives right at the very start. Finding out what is it that we want to achieve, what outcomes we want to see, what kind of actions we want our target audience to do. So setting clear objectives sets us in the right path. Okay, and we use plain language without compromising accuracy. And when there are times that we need to use technical details, right, technical information or terms, which sometimes we cannot avoid, we have to make sure that we provide explanation or descriptions where people can understand, right? And for Project Wolbachia, our focus is really on science-based communications. Another important aspect of providing clear messages is that we need to be aligned in all our communications materials. Alignment is really important because we want to avoid confusion. We want to avoid misunderstandings, right? And that's important. And in a multiracial country like Singapore, we make sure that we have our communication materials translated. So we have 4 languages. We need to check and double check to make sure that there's translations, the meanings remain the same across all. So here's an example of how we translate scientific concepts to layman terms. Wolbachia suppression technology is quite a handful. Okay, not many people know that, right? And how do we then explain it to the public? Cytoplasmic incompatibility, Dr. Chong mentioned this earlier. This is a very technical term, but in our public education, we explain it in a different way. We say that in text form, we say when male Wolbachia aedes mosquitoes mate with urban female Aedes aegypti mosquitoes that don't carry Wolbachia, their eggs do not hatch. So there will be no offspring. But even in text form, people find it off-putting because there's too many texts. So they sometimes get turned off. And using illustrations, drawings, videos, this helps convey the message clearer, right? So we use a combination of text, illustrations, videos to enhance understanding and to convey and to attract attention as well. And Wolbachia, since it's a relatively new term, not many people know it. We have to explain a bit more and assure the public that it's safe, right? And that's why in our communication materials, we say that, Wolbachia is a natural occurring bacterium found in most insects. And it is safe. Yeah, people want to know that, the technology that we're deploying in the community is safe, that will not cause any harms to humans or other animals. And to make Wolbachia more relatable, not exactly more relatable, but make it more friendly, okay, less scary. We don't want to make Wolbachia scary, right? So we had this mascot that was developed in-house by one of our colleagues. We call it Wozy, the Wolbachia mascot. So Wozy in the mosey, in the mosquito. So make it more catchy that way. All right. Another aspect of public education that we are mindful of is that it has to be appropriate, right? We need to make sure that we're conscious of who our target audience is and customize the messages, okay? Not one size fits all. So we have to make a deliberate attempt to find out, what is the situation on the ground? Why do we need to communicate to our target audience? What are their concerns? When do we deliver the message? And how? What are the channels to use? Right? And in this example of a poster that we used recently, it came about because there were concerns that there were some dengue cases happening in the release sites, right? And people are concerned, the residents are very concerned because they can't distinguish whether it's the NEA male mosquitoes or is the female that cause dengue. So in terms of messaging, we have to tell them that they still need to stay vigilant, that they can kill the mosquitoes and they need to protect themselves from mosquito bites. So these are some of the communication materials that went out to address this concern when there was dengue cases in the release site. Another important point that I would like to suggest is to pre-test your message and materials, right? This is important. Pre-test it to somebody who's not in your field of work, right? And to see whether your messages have been understood clearly. Okay. In terms of public education, we have to be consistent, okay, across all our materials to avoid misunderstanding. I mentioned it earlier, and we need to track the messages that has been published or shared. This is important. We need to know what we say and to whom, right? And that we ensure consistency across. And I've highlighted some of the terms that we commonly used in all our communication materials here for Project Wolbachia. We highlight that it's a complementary tool, that it is not a silver bullet. So this messaging is important because we want to manage expectations as well, because the project is still under study. And we want to highlight that this is supposed to help and to enhance NEA's dengue control program. And traditional methods of dengue control will continue, right? It's not going to be replaced. We also highlight that what we release are male Wolbachia carrying Aedes aegypti mosquitoes, because the project only targets Aedes aegypti. And most important of all, the project objective, which is to suppress the urban dengue mosquito populations. And another important message that we highlight in all our communication materials, that male mosquitoes do not bite, right? To give assurance that residents that these male mosquitoes will not harm them. Another important point for consistency is your program name. Okay, logo, if you use logo, and contact information. So on the right side, I've shared this sets of pamphlets that we've distributed over the different phases of the program. So you can roughly see that it's the same look and feel and consistent in terms of branding. So it helps establish familiarity, all right, familiarity and branding for Project Wolbachia. Okay. For public education, our approach it has to be accessible and timely. Accessible meaning, like I mentioned, have it available in different languages, use graphics, photos, and videos, and distribute it in various channels, right? So you can reach more people. Because for Project Wolbachia, when we reach out to residents, it's quite diverse. So we have people across all ages, right, and different literacy levels as well. So we need to make sure that we are able to reach everyone, right? And we have website information on Project Wolbachia is an NEA website, and here we can provide more details. We also have a section here that explains a bit more on the technology. So the technical aspects is also here. We have a hotline number where residents, the public can contact us for more information. And another important aspect of public education is that providing regular updates. So we convey good news and the bad news as well. And stay relevant this way. And we're able to build trust and accountability to our stakeholders this way. Conveying bad news it doesn't mean it's all bad, but we want to highlight that if there are dengue cases in release sites, then what do we do? We sort of use that as a platform to get community partners to remind them that the residents still need to do their part, prevent mosquitoes from breeding. And in conveying all these project updates to our partners, we also highlight to them areas of concern that we need their support in the environment, in the community, to bring the mosquito population down. Okay, just sharing with you some of our communication channels here. Our corporate communications department has been very good engaging the media through press release, press briefings, interviews, comments and replies on articles. So we've had quite a fair bit of media coverage over the years, creating more awareness and building that credibility for Project Wolbachia. So in terms of our targeted approach, this is more for the release sites itself. We produce pamphlets, newsletters, and flyers, and we distribute them door to door. Also mail drops. When we do ground engagement and events, we distribute our printed materials. And because we have strong relationship with the community, they allow us to put posters at the lift lobbies, recreational centers, high traffic areas where we can have more visibility for the project, inform the residents. Okay, and because of COVID, we really shifted a lot of attention to online channels. And this is where we also work with community partners to share information online. We work with politicians, community leaders, experts, famous personalities. In this example, when Prime Minister visited our place, we featured, he posted it in his social media, and then we cross-shared it as well. And we also had the opportunity to work with National Geographic together with other agencies in Singapore to feature Project Wolbachia. And the last one on the right is our Corpcom's team actually managed to get NAS Daily to feature Project Wolbachia. Okay, so another important component of our community engagement framework is consultation with our stakeholders, right? So the parties in this circle are all very important to ensure successful outcomes for the project. So for the Environmental Health Institute, we are the research partnership team. We manage the research, we conduct situational assessment, we can engage the community and handle technical queries. And we work very closely with field officers. These are our vector control team to address queries and concerns from the residents. They also conduct the surveillance and enforcement action when needed. Another important internal stakeholder is 3P, the people, private, public team. They manage the relationships with the community leaders, and they drive the national campaigns. So we work through them because they have strong relations with the community, and ensure that we're able to leverage on the national campaign as well through their communication channels. So I mentioned earlier as well, our corporate communications team, they ensure alignment of messages and help us manage public views. For the external stakeholders, we engage with independent experts and advocacy groups, right? And they provide unbiased views on Project Wolbachia to give us that check and balance and guide us on our study design and evaluation. Okay, and as part of our national dengue control strategy, we have an interagency task force, and this ensures ongoing dengue prevention efforts and support community action. These are working with various agencies and town council in delivering services to the community. Another important stakeholder here are leaders and influencers in the community. These are your politicians, community leaders, and volunteers. They focus on the welfare of residents, and they are at the forefront of community mobilization. And last but not the least, the most important stakeholder in this are the residents, the public, right? So we need to make sure that we get their support. Because no matter how good the study is, if we don't get public support, it's not going to happen, right? And we need them to cooperate and ensure that there's no mosquito breedings in their homes, which will hamper the outcome of the project. Okay, so for the third pillar, in terms of the way we engage and involve our stakeholders in the public and the residents, we use science-based learning activities, and we try to make it very engaging, right? So as I mentioned, during COVID-19, we switched to social media channels. So we use interesting videos, fun facts, interesting illustrations. We conducted like online games, like a simple crossword puzzle. Spot the difference between male and female mosquitoes, all these things, including Facebook Live sessions with our community partners. So these are the ways that we continued with our science-based learning activities online. So other forms of engagement activities, now everybody is doing Zoom. So yes, so we leverage on our partners' platforms to conduct briefing and sharing sessions with community leaders and residents. And this provided us an opportunity to address their concerns, clarify their misconceptions, and we are continuing to do that. We have also recently started deploying ad walkers in the community, at eateries, bus stops, markets, right, to reach our target audience. We used to do a stationary kind of booth in a place where, you know, we then have our live exhibits mosquito on display to show that mosquitoes don't bite. But right now, because of restrictions in social distancing and all that, we tried this approach, and it's been working well. We don't just give out flyers to residents, right? So we engage them in a simple activity, true or false, focusing on our key messages, and give them a token, a simple token of appreciation for their participation. All right. And since we cannot bring residents to our mosquito production facility, we then tried a different approach and invited community leaders, students, even politicians to join us for mosquito release, because we have schedules, right? So we tell them, come and join us, so we can share more and let you know that, you know, the male mosquitoes released do not bite, and explain to you the strategies that we use for releasing mosquitoes. Then we show them our gadgets, you know, our mosquito launcher. And what is interesting about this activity is that we had the community involved, right? And we featured them in our social media. They allowed us to do so. So this video, that a very short video that I would like to share with you, it's produced by our colleagues from the Environmental Health Institute. So thankful that we have many talented officers in-house to allow us to produce videos and content like this for social media. All right, so let me just briefly switch and share with you this video. Sorry.
Dear residents, you may have noticed more mosquitoes lately in Hong Kong North. These male mosquitoes come from NEA's pilot of Project Wolbachia in our estate. Let's hear more from one of the scientists behind this project.
NEA has been releasing male Wolbachia Aedes mosquitoes in parts of Hong Kong North to help fight dengue. When these male Wolbachia Aedes mosquitoes mate with female dengue mosquitoes, their eggs do not hatch. Continued releases will eventually lead to fewer dengue mosquitoes and less dengue.
There's a buzz in the air here this morning as we join NEA scientists. NEA carries out releases on Tuesday and Friday mornings. It is okay to close your windows and doors during these times.
I did enjoy releasing the mosquitoes, as it was a new and interesting experience to me. I will support Project Wolbachia because it helps to stop the dengue.
Don't worry, these male mosquitoes do not bite and they do not transmit disease. It is okay to kill any mosquitoes you see as you normally would. Project Wolbachia requires time to make an impact and is not a silver bullet. We must continue to be vigilant against mosquito breeding and protect ourselves and our loved ones against mosquito bites. Let's fight dengue together!
All right, so everybody can hear me? If you did not catch the video clearly, I will be sharing some of these links in OneDrive. We have a lot of social media content. So I just selected one that illustrates the part about community involvement and partnership, which is in this video, right? And really thankful for the strong support of the local politician, Dr. Amy Kaur. She's also our Senior Minister of State for Environment. So yes, she's very supportive and enabled us to do a lot of things in the community and to reach more people. Okay, so the fourth component of our community engagement framework is feedback management. Our approach has always been transparent. We're going to be responsive and consultative, right? And I've mentioned that residents are the most important stakeholders in the community. Their feedback is very important, and addressing that feedback helps to maintain trust and accountability, right? And we receive feedback in various channels, directly to our NEA hotline number, email, or even face-to-face when we go for our releases, as well as our community events. We receive feedback through our community partners. They will channel all this feedback to us, and residents do approach the media to raise their concerns as well, right? And based on experience, we know that when we release in a new area, there's a temporary increase in feedback, right? So we try to really try to reach out all the residents in the area, but we know that we cannot reach 100%, right? And we continue and sustain the efforts in public education, so not just at the start, but ongoing. And when we receive feedback, all right, so it's important to monitor the feedback. Like I mentioned, we monitor the type of feedback, right? So whether is it feedback on seeing more mosquitoes and where, whether they're experiencing any inconvenience and all that. We also monitor the frequency of how many feedback that we receive in a certain area, because these are important, provide us insights later on, which I will explain later. And this feedback provides us a trigger point for us to do situational assessment. So we look at the mosquito population in the area, conduct targeted inspections, and if there are breedings found, then we destroy the breedings and take enforcement action if needed. Yeah. And more importantly, when we manage feedback, we coordinate an appropriate response with all our stakeholders, right? So it's not just Environmental Health Institute alone or just NEA. We consult our stakeholders when we engage feedback providers and close the loop in a timely manner. This is important to avoid aggravating the situation further. Okay. So I would just like to share with you a very nice story. We seldom get this, and I think it's important to highlight how a negative feedback can turn into positive. So in this scenario, Mr. X sent a feedback to NEA and to primary school regarding numerous mosquito bites suffered by his sister while in school. So he showed us the photos of the bites and claimed that his sister saw many mosquitoes in school, right? And the context is that Project Wolbachia was introduced in the neighborhood a few months back, okay? And the releases are only done at the residential buildings, but you know, it's quite close. The school is quite close. And typically before releases start, NEA will send an email and letter to the school for the principal, the staff, and the parents to be notified about the releases in the nearby area. So what we've done is that quickly went into action. Our field officers, our vector control team, who had good relations in the community and know the school principal, contacted the school. We reached out and because we wanted to do ground inspection and surveillance in the school. And with that, our research team joined them and conducted this inspection and surveillance. And they found that, you know, there's presence of biting midges and albopictus in the school, right, after the surveillance. And with that, they provided guidance to the school on how to manage the insects and the mosquitoes, and support their vector control operations in the school. Right, and another team, my team, actually handled the feedback, contacted Mr. X, and explained what Project Wolbachia is all about, and shared the steps taken to reduce the mosquitoes inside the school. And of course, we advised him to remind the sister to apply insect repellent when going out. Okay, and because of this feedback, the teachers in the school get more interested in Project Wolbachia. They conducted sharing sessions with their students as part of their science module. And the school also sent information on Project Wolbachia and dengue control efforts to parents. We also had students and teachers participating in our mosquito release activity. And with that, they allowed us to feature them in our publicity materials. And at the end of the school year, they gave us a partnership award. So really very surprised and kind of heartwarming to receive that kind of appreciation from community partners. Okay, another uh, important point I want to highlight about feedback is that these are learning opportunities, right? And it allows us to enhance our communications and engagement. In this poster that we produced during COVID, we knew that it was important to highlight that dengue remains an important public health concern. Okay, people are very concerned about COVID, but dengue is also important. So we did that, and we highlighted that, consistently, that males do not bite and transmit disease to assure the public that the project is safe. Okay. Another important feedback that we received is that people wanted to be informed of the schedule, right? So that they don't feel so powerless. So there's some inconveniences that they felt, when mosquitoes are swarming their home and things like that. So we tell them that, we release on certain schedules. Please close your window and doors. And of course, we remind them, continue to do as per normal. Yeah, do your mosey wipe out, prevent breeding from your homes, and protect bites. Okay, so feedback also allows us to identify gaps and make adjustments in our inspections as well as our mosquito release strategy. Right, on the left, you see officers conducting inspections in the vicinity of the homes. And we do sometimes visit the residents to address their concerns face to face. Right, and residents also alert us if there are areas of concern in the community, like unkept place, rubbish area, construction areas that can be potential breeding sites. So this allows us to adjust our mosquito release strategy. And I would like to share with you the evaluation that we've done to get a sense of how we're doing in terms of our communications and engagement, whether we're meeting our objectives. We conducted this survey between September and February. Our sample size is about 500. These are existing study sites, all right? And we went house to house conducting this survey. We found that 75% of the respondents have heard of Project Wolbachia Singapore, so we're very glad for this. Majority heard of Project Wolbachia through our posters and banners. So it is an important medium to reach out to residents. And mainstream media like news, radio, and TV are also important. Okay, and we're also very glad to hear that 96% are supportive and does not object to Project Wolbachia. So these findings are very encouraging for us. And also, I would like to mention that this survey, we developed and conducted this with National Technological University of Singapore. So we collaborated with them to develop the questionnaire and now doing the detailed analysis for this survey. Okay.
Excuse me, 2 minutes.
All right.
2 more minutes.
So, all right. So the survey provided useful insights on knowledge gaps, and now we're able to focus our communications. And these are the key messages that we emphasized moving forward as a result of the survey. Right. And for the game plan, just to share with you a simple checklist to get you started on your communications engagement plan. I would like to suggest, yes, very much so, in starting your objectives. State your objectives clearly, right? Know your target audience, segment and prioritize, right? And identify your key messages for each target audience. And list down your communications and engagement platforms. Okay, not include your community partners. Okay, leverage on your partners' channels to reach out to more people. And yes, evaluate your activities so that you know whether it's the right way to go or not. You can do that through surveys, monitoring feedback, through media reports as well. Budget is also an important consideration. If you can do things in-house and leverage on your colleagues' expertise and skills in developing materials, please do that. And then also leveraging on partners to develop customized messages for you, right? And prioritize. And lastly, set your timeline as well. Okay, this is just an example of how we do all this for Project Wolbachia in terms of our objectives. Immediate is really to increase awareness and garner support. In terms of long-term objectives, we want to promote shared responsibility with the community. And in terms of target audience, we segment it by area and prioritize the key messages we want to convey. For current study sites, it was important to continue with messaging on updates on the progress and positive outcomes, and the need for continuous releases to sustain the suppression, because often they will ask us, okay, when will this program end? And it's important to highlight to them that we need to continue, right? And for the new study sites, of course, we need to highlight to them that we've achieved good results, and that's why we are expanding, and why we need to release some mosquitoes in terms of the objectives of the program. To expect to see more mosquitoes because of the releases, so the schedule will be there. Again, to highlight the other key messages consistently across, right? Another important thing that we also consider are the residents in the surrounding areas, okay, because they may feel the spillover effect of the releases. So we also engage them. And for practice, I'm sharing this with you all. You can do this like, after the sessions when you have time, is to go through this exercise to help you design and plan your communications materials. So for number one is select a public health program in your area of work that requires community support, and indicate the following: your project name, communication objectives, state who's your target audience, and identify key messages, just 3, okay? Make it very clear and succinct, okay? And number 2 is create a poster out of that, all right, to convey your key message. And thirdly is something interesting for you to try, tricked on how to zoom in on what's essential in terms of your key message and keeping it short. So, you're given an opportunity by a local telco company to reach your target audience via SMS. So with 320 characters inclusive of space and punctuation and all, convey your message to your target audience, which will be sent to the mobile phone. I've indicated an example here for you to refer to. And that's all I have. I'm happy to answer any of your questions later on, or you can also contact me by email. Thank you.